Hi, everyone. Welcome to our Legislative Goals Training webinar. I'm Emily White. I'm the Fight CRC Advocacy Manager, and today I have a few members of our Grassroots Action Committee joining us.
Hi, I'm Kristen Keeson. I am a colon cancer survivor, and I've been attending Colon Congress for 4 years.
Hi, I'm Maria Williams, and I'm a caregiver for a colorectal cancer survivor, and I've attended Colon Congress twice.
And unfortunately, Bunny will not be joining us today, so I will be filling in for her. Before we get started, I'd like to give you an introduction of who Fight Colorectal Cancer is. Here at Fight CRC, we demand a cure for colon and rectal cancer. We have 3 focuses: advocacy, research, and awareness. Today, we'll be talking about advocacy and what our legislative goals are here at Fight CRC. Each year, we work with our partners and strategic alliances to develop our legislative asks. We have 3 primary goals that are pretty consistent, but the funding numbers change each year based on appropriations. These goals are making a commitment to research, funding for the CDC colorectal cancer screening programs, and removing barriers to screenings. All of the information can be found at fightcrc.org/change-policy. We have detailed backgrounders and more information on all 3 of these issues.
Our first legislative goal is making a commitment to colorectal cancer research. Fight CRC is asking Congress to continue to include colorectal cancer as eligible for research funding under the Department of Defense's peer-reviewed cancer research program and support an increase in funding. Why DoD? Well, colorectal cancer is one of the most common forms of cancer among active duty military personnel. Additionally, service members who are exposed to ionizing radiation in the field are at increased risk of colorectal cancer. The program has supported research into a non-invasive genetic urine test for colorectal cancer, as well as research on genes associated with ionizing radiation sensitivity and resistance. As published in the 2009 Humana Military's Clinical Quality Report Card, only 58% of those in the military were up to date with screening in 2008. That is lower than the national average. The PRCRP has supported research into treatments for colorectal cancer, including research into treatments that would block the growth of metastatic colorectal cancer. Fight CRC is also asking Congress to make funding for cancer research, including colorectal cancer research, a top priority. Support increases in funding for National Institutes of Health, including the National Cancer Institute. Cancer research funding as a share of the NIH budget has declined while the scientific and public health needs has gone up. In the late 1990s, the NCI's budget made up 18.7% of the NIH budget. Today, it is 16.4% of the NIH budget. A renewed federal commitment by Congress to cancer research funding is needed.
Our second legislative goal is funding for the CDC's colorectal cancer control program. Currently, that program funds screening and education programs in 25 states and 4 tribal nations, playing an important role in increasing colorectal cancer awareness and helping patients navigate screening. This program has 3 components: screening, education, and awareness. So even though the Affordable Care Act provides for screening for those with insurance, this program is still very important for raising awareness and educating communities. A funding level of $70 million would provide for these programs in all 50 states. Fight CRC is asking Congress to increase funding for the CDC in order to expand the number of CRCCPs. More information on these programs can be found on the CDC website, www.cdc.gov. www.cdc.gov/cancer/CRCCP.
Our third legislative ask is removing barriers to colorectal cancer screening. Fight CRC is asking Congress to pass legislation to eliminate Medicare beneficiary coinsurance for colorectal cancer screening colonoscopy. Medicare law covers colorectal cancer screening without Medicare beneficiary cost sharing, coinsurance, and deductible. This is so important because so many times when people go in for colonoscopies, Medicare colonoscopies, that it's a screening process, but if the doctor finds a polyp, then it becomes a procedure, and then folks are charged for that procedure. So it's an oversight in the law, and what we're asking is for the removal of barriers to colorectal cancer screening. We'd like the law to be changed so that if a polyp is removed during a screening process, that Medicare beneficiaries are not charged. Last Congress, the 113th Congress, the House Bill H.R. 1070 had 158 co-sponsors, and the Senate Bill S. 2348 had 15 sponsors. We will be reintroducing this in this current Congress.
Thank you so much for learning about our legislative goals. If you have any questions, you can send me an email. My email address is emily@fightcrc.org. You can also find more detailed information at fightcrc.org/change policy. Thank you.